Hi, my name is Anastasia Jackson, and I'll be talking with you today about IBD in pediatric patients. Hi, my name is Anastasia Jackson, and I'll be talking with you today about IBD in pediatric patients. My literature review question was, is infliximab or prednisone more effective in treating IBD in pediatric patients? Inflammatory bowel disease is a disorder of the gastrointestinal system, and there are two categories of IBD, Crohn's disease and ulcerative colitis. Ulcerative colitis is a condition where inflammation and ulceration of the colon and rectum is observed. Common symptoms of ulcerative colitis is diarrhea, often with blood shown, abdominal pain and cramping, rectal pain, rectal bleeding, urgency to defecate, inability to defecate despite urgency, weight loss, fatigue, and fever. Crohn's disease causes inflammation in part of your digestive system. It can affect any part of it, but most often it affects your small intestine and colon. Common symptoms of Crohn's disease is diarrhea, fever, fatigue, abdominal pain and cramping, blood in your stool, mouth sores, reduced appetite and weight loss, pain or drainage near or around the anus due to inflammation from a tunnel into the skin. IBD is on the rise in pediatric patients, and there are two treatments that are commonly used to achieve remission: infliximab and prednisone. Infliximab is a monoclonal antibody biologic drug created with human tumor necrosis factor, and it works against tumor necrosis factor alpha, which is a chemical messenger that creates an autoimmune reaction. An initial dose of infliximab is 5 milligrams per kilogram at 0, 2, and 6 weeks, and is followed by a maintenance treatment of 5 milligrams per kilogram every 8 weeks after. Each infusion takes about 2 hours. Prednisone is a corticosteroid that is used as an immunosuppressant, and it boosters of inflammation and inflammatory diseases such as IBD. Corticosteroid treatment may be effective but correlated with adverse reactions such as hyperglycemia, hypertension, growth failure, weight gain, adrenal suppression, mood disturbances, osteoporosis, glaucoma, and cataracts. It is taken orally in 2.5 milligrams a day or 5 milligrams a day dosing for pediatric patients. So I will bring up the question again. Is infliximab or prednisone more effective in treating IBD in pediatric patients? Well, based on the findings from the studies, due to adverse reactions prednisone causes, it is not for long-term use. Infliximab long-term and also have high risk of remission, which is the main goal for IBD patients. So let's discuss these studies that support this statement. In case study 1, a 17-year-old female was diagnosed with Crohn's disease. Initially, she was treated with hydrocortisone every 6 hours for 5 days, given 5 days of antibiotic. She was then given metronidazole 500 milligrams 3 times a day, and ciprofloxacin 500 milligrams twice a day. On this treatment, the patient did improve. However, her gastrointestinal lining did not heal. She also continued to have diarrhea and abdominal pain. The patient was started on a new treatment, a top-down therapy utilizing infliximab in combination with immunomodulatory drugs. Immunomodulatory drugs help to decrease the body's immune response to inflammation in IBD. The patient underwent 2 subsequent treatments with infliximab. 6 weeks later, her comprehensive blood work results showed improvement in her bowel movements were semi-solid with no blood. Furthermore, the patient gained weight, reported improved feelings of wellness overall, and her gastrointestinal lining healed. The gastroenterologist decided to keep the patient on infliximab to prevent reoccurrence. This case study suggests that infliximab resulted in an accelerated healing of the mucosal lining and may reduce hospitalizations in pediatric patients with IBD. Continuing to case study 2, an observational study found that 79% of children diagnosed with ulcerative colitis received corticosteroids in the first year of being diagnosed. Corticosteroids are typically used to maintain remission rather than a long-term treatment. According to authors, 89% of the children receiving corticosteroids had inactive or mild ulcerative colitis 3 months after the start of corticosteroid therapy. After 1 year, 45% of the children became dependent upon corticosteroids. Corticosteroids are naturally secreted from the adrenal gland. However, when it's taken as a medication, it can suppress the natural secretion, and your body tends to function better while on the medication, making it hard to wean off the medication. Corticosteroid treatment failed in treating 5% of the patients and led to a colectomy. In case study 3, in 2010, 52 children with ulcerative colitis participated in the Pediatric Inflammatory Bowel Disease Collaborative Research Group Registry. On the initial visit, 8% of the children had moderate to severe ulcerative colitis. 34% were treated with infliximab, while 66% were treated with corticosteroid or thiopurine. Infliximab was given as a maintenance treatment in 65% of the patients. These treatments resulted in the patients either reaching remission or experiencing a reduction in ulcerative colitis severity. Furthermore, 72% of children did not have to undergo a colectomy following the treatment. This study suggests that infliximab is effective in treating pediatric IBD patients, especially when corticosteroids fail. In a child, it is best that a child does not receive a colectomy because that is a part of their colon that is being removed from their intestine. In case study 4, in a study conducted by Zhu and Coyne, 49 patients diagnosed with IBD at Fudan University Children's Hospital in Shanghai, China were treated with either prednisone or infliximab. Corticosteroids such as prednisone were given to all patients most responding well. 3 patients were given infliximab when the steroids failed to improve symptoms of IBD. These patients showed improvement after the first infusions, unlike the patients receiving steroids, and experienced no adverse reactions. Infliximab is expensive, so this treatment costs in developing countries like China. This study suggested that infliximab treatment can help pediatric patients achieve remission. And our last case study, several random clinical trials comparing prednisone and infliximab in treating pediatric IBD have been conducted. According to Hyams, infliximab was given to 60 patients 5 milligrams per kilogram every 6 weeks versus every 12 weeks intravenously to 60 patients with moderate to severe Crohn's disease, aged 6 to 12 years, from August 2006 to June 2010. 38% achieved remission at week 54 during the 8-week trial, while 18% achieved remission in week 54 at 12 weeks. According to Mark Cowlitz, 55 patients with moderate to severe Crohn's disease ages 12 to 18 years old received 6 mercaptopurine 1.5 milligrams per kilogram a day, plus prednisone 40 milligrams per day, while a group received a placebo plus prednisone 40 milligrams a day. 89% of patients showed remission in week 48 in both groups. That study resulted in a 9% relapse, with 6 MP at 40